Welcome to this webinar in the IComply Expert Series on KLOEs and the new inspection regime. For those of you who don't know me, my name's Alex O'Neill and I'm Code's Practice Consultant Manager. I think there's quite a few familiar faces in the room. And what I'm going to talk to you about today is the key lines of inquiry and the new inspection regime, which have come out, which has started pretty much now. And it's related to the dental handbook, and hopefully I'm going to demystify the information that the CQC's put out there and make it practical, understandable for you. And I'll also show you how IComply helps you with the KLOEs and the new inspection regime. Okay, so the idea is that by the end of this session, you should understand the key changes to the inspection regime. You should have an overview of the key lines of inquiry. Now, in subsequent webinars, we are going to go through them one by one and show you what you're doing with IComply in order to meet these key lines of inquiry, or more in order to be able to answer the questions that the inspectors have down on their prompt sheet when they walk in to the practice. You're going to understand how the KLOEs relate to the fundamental standards, or how the CQC have explained this in their documentation. It mostly makes sense, but as we'll see, it's not 100% clear, but we can get a good understanding from looking at it. And we're going to understand how the IComply application is going to help you with the inspection prompts, and that's to do with the KLOE report. So, CQC inspections. Just a little bit of sort of history or explaining where we've come from. I've set it down here, there's a need for consistency, and CQC inspections have been, up until recently, very much a bit of Russian roulette. You never know whether the inspector is going to have dental knowledge. You don't know how long they're going to stay for, whether or not they're going to be discussing safeguarding with you, or whether they have any dental knowledge at all. It's been very inconsistent. I'm sure most of you have probably found that, and quite often you've been able to show people show inspectors your evidence folders or explain to them your decontamination process, and they take you at your word, or they have been quite impressed by what we've shown them. But now what we're actually finding is they're going to be a lot more knowledgeable. So the CQC have responded to this and are training their inspectors to be specialist inspectors for dentistry. And what we're actually seeing with the new inspection reports that have been published 2 weeks ago is that they're actually very knowledgeable, and they really know what they're talking about down to a fine detail. And we'll cover that in a slide later. But I don't want to dwell too much on the past. But as I said, it was very much a sort of a yes-no tick box compliance approach from the CQC. It was inconsistent, different lengths of inspections, different levels of depth. Generalist inspectors, not specialist, quite often coming from care homes, and unclear standards. So now we've got the fundamental standards, which are prescriptive, legally enforceable, and they make a lot more sense for dentistry, especially. So the new inspection regime. The new inspection regime is data-led, and by data-led, what I mean is they are going to be researching you before they come into your practices. So they're going to be looking online. They will be looking at Health Watch as well, but they're probably going to look at your NHS choices, and I would imagine any other sort of public review sites. So one of our sort of top tips for the new inspection regime is control your public image, the data that's out there about you right now, and answer any reviews that people are putting online about you. Even if they're bad reviews, then use that as an opportunity to respond or tell people that you do care. And obviously respond to positive reviews. Thank people for their positive reviews. But the bottom line is the CQC are actually going to be looking out there to see what they can see about you before they come in. So whether that's going to the GDC, to the BSA, looking at online reviews, we'll see. Key lines of inquiry, I won't go into too much detail on them about now, because obviously we're going to cover them a bit more later. Provider handbooks, we've got a provider handbook now that was published in November. It's about 55, 60 pages long, and it's very clear about what they're going to be looking at and what prompts, and we'll be talking about that as we're going through these slides. Specialists and experts, this is basically what I just said before. Their teams of inspectors are being trained on dentistry or whichever field they're going into. So what we used to have before, obviously, were generalist inspectors, but now there's going to be a specifically trained sole sort of dental inspection team. Whole day inspections. This is the most important point, I think, for everybody, is that they're coming for a whole day and they're looking at all standards. So whereas before they came in and they looked at, say, 5 out of 17 outcomes, they're now going to be looking at everything. And with an expert eye, with a knowledgeable eye, which we'll see shortly. And then a patient and a team focus. It's not just about policies. Well, it never was just about policies, but they want to see that your team are trained on your policies, that they're aware what your standards are, and that your policies are being updated, and you're retraining your team on them. And there have been sort of notes in one CQC inspection report I read last week that did say quite clearly that policies haven't been updated. And then obviously that's what we do in the IComply system, is you'll spend a month on a topic, updating policies, procedures around a topic, and then at the end of the month you train your team on what you've done. So obviously these policies are live, living documents and not documents that are templates in a dusty folder. So inspections, passed, failed. This is just a small point I wanted to make, which is I think it's really important, because before, when the CQC came in, they looked at 5 possible outcomes. They looked at less than a third of what they could look at about your practice. So what I've found in my career is going into practices, quite often people have metaphorically dodged the bullet, because the outcomes that they were being inspected on, they were fine on, but the ones that they weren't being inspected on, they weren't necessarily compliant. So the reason I'm mentioning this is because now's the time, before they come to your practice and they start looking at everything, now's the time that you can do this. You should start looking at your whole practice and start looking at all the areas of compliance. Most of us know where we're not compliant in a practice and what our weak areas are. So address those. And they're actually going to ask those questions when they walk in. One of the things in the handbook that they're saying is, as soon as they walk into your practice, they're going to say to you, well, where do you feel that you need improvement? And obviously, by doing this exercise right now, you're going to have the answers to those questions and hopefully an action plan. So pre-inspection, what are they going to do before they inspect you? Well, they're going to write to you. They're going to give you 2 weeks notice. That's what they've said. And they're going to send you comments cards and a poster for your patients, so that you can, so your patients can ask to fill out these comments cards, that they're aware that there's an inspection coming. They've said that they're going to ask for about information to do with complaints, compliments, and up-to-date statement of purpose. This is the provider handbook itself. I would download it. It's only 55, 60 pages long, and it's very, very informative. And the main things that are coming out of this, the handbook, and this is what we've done, is looked at this handbook, we've read it, we've digested it, and we're seeing themes within it that are being backed up by the inspection reports that are coming out right now. So obviously, I mentioned earlier, we're getting full day inspections with all regulations. Then an interesting one is the inspector's going to talk to the most senior person available. So they're no longer only going to wait for the registered manager or the nominated individual to be there. I do know some practices that had their inspection delayed because the registered person wasn't available. So now they're actually going to come and they can just speak to you straight away. 10% of practices inspected in the next 12 months. A lot of people are under the impression that this is going to be every single year. They're only going to do 10% each year. The honest answer is we're not really quite sure. They said they're going to do 10% over the next 12 months, but this is just a pilot. They're trying out this new regime. So I wouldn't take that as the idea that they're going to then inspect one practice every 10 years or something. I guess we've got to wait until next year to see how it actually pans out. Direct line to the GDC. This is quite interesting. I've heard this described to me as, basically, before, if the CQC walked into a practice and there was a problem, they had to escalate it within their own organisation, and then it would get shot across to the GDC and then come down. So it was they didn't really have any direct line of communication, but now they pretty much have a horizontal line of communication where if they find a problem, especially with something like consent or clinical records, basically what they've said in the handbook as a fitness to practice issue, they can just ring up the GDC straight away. And they've got this direct communication set up now. Mental capacity focus, and every single inspection report that's been coming out has mentioned mental capacity. So if you've not had any mental capacity training, or you've not read documents, or your team aren't aware of what to do if there is a problem with mental capacity, then I would really, really advise strongly going and doing something about it right now. Clinical records focus, I did mention this just before, but they have said that they are going to come in and they are going to look at your clinical records with more of an expert eye. So they're looking for consent, they're looking for options, risks, benefits, discussions with your patient in order to make sure that consent is informed. How much detail they go into on this, I'm not quite sure, but it remains to be seen. Quality assurance focus. Under the key line of inquiry, well led, they've actually said for the first time that they want to see that you are using continuous improvement and quality assurance. Which fortunately enough for IComply users you are, this is a quality assurance system that makes sure that you are setting standards, training your team and then auditing them on those standards and then continuously improving. So for anyone who's seen me talk before, I always say that it's not about doing the risk assessment or the audit. It's very easy to do a risk assessment or an audit and then put it in a file. It's about doing them, seeing them what they tell you and then making improvements to the practice within a reasonable time frame. Not having an audit from 2 years ago in the cupboard that hasn't been acted upon. So just moving on from that slide. So now, looking at the key lines of inquiry themselves, what they've said is they want to see that practices are safe, effective, caring, responsive, and well-led. I won't read out exactly what it says on the slide because obviously you can see that in front of you, but essentially safe is it safe for your patients and is it safe for your staff? Do you have health and safety risk assessments in place? Is the infection control up to standard? Effective is are you effective as a team? Are your team well trained? Are they supported? Do they get the job done? And obviously are people's care and treatment, do they achieve good outcomes, desired outcomes? Caring is obviously, do you care? Do you respect patients' dignity? Information governance, for example, would come under caring, etc. Responsive, are you organised so that you meet people's needs and you're responsive? So how do you deal with complaints? How do you deal with patient satisfaction surveys, etc.? And well-led, obviously we covered this before, but this is, do you have a governance system? Do you have goals for the business? Are you a leader? Is there a culture in place in your practice? So they're going to be coming and looking for continuous improvement for quality assurance, which obviously the IComply system is. So for those who have it, that's very powerful for you to demonstrate it. And these the safe, effective, caring, responsive, well-led, the key lines of inquiry or KLOEs are what the inspectors are going to be looking at when they come in. So in the handbook, you've got these 5 areas, KLOEs, with prompts around them. And they're linked to the fundamental standards. This is where I said earlier it's a little bit confusing because they don't quite match necessarily, and it's a little bit subjective. But what they've said obviously is that these particular fundamental standards line up with these KLOEs. So what you could do is go and have a look, and if you have the time, I'd advise you have a look at the fundamental standards, you have a look at the KLOEs in the handbook, and you start looking at your practice like an inspector would. You start thinking, well, are we safe? Are we effective, caring, responsive, well-led? And you look at what they're looking for with the inspection prompts. I'll show you how IComply is going to help you with that with the KLOE report. But you found that's quite powerful stuff to start thinking in the mind of an inspector and how an inspector would look at your practice. So these are some prompt examples from the KLOEs. So you can see Safe 1, what systems, processes and practices are in place to prevent healthcare associated infections. So obviously it's to do with your infection control, and they do really know what they're talking about with infection control to a very fine level of detail now. E2, the practice obtains valid consent. Now, what is valid consent? Valid consent is that options, risks and benefits were discussed with the patient and they made an informed choice. So do your clinical records reflect that? C1, caring 1. A patient's treated with kindness, dignity, respect and compassion. while they receive care and treatment? And are they involved in their treatment? Are they given treatment plans? Are they given advice leaflets? Is their identity protected? Are they respected if they have disabilities, etc.? How does the practice listen and learn from people's concerns and complaints to improve quality in care? So are your complaints being tracked properly? Are they being responded to in a timely fashion? One of the new CQC inspection reports that came out a couple of weeks ago said that one practice had a complaint in, and the practice had responded to it within 3 days, saying that they would have an answer within 6 months. So the CQC inspector quite rightfully said that they're not listening to people's complaints or responding adequately. And then W3, we spoke about this before. How is quality assurance used to drive continuous improvement? So the new inspection reports that we're seeing coming through right now are actually pointing out where practices have action plans in place, or whether they don't have them in place, and whether or not they've actually got their audits on file or they're being acted upon, etc. So it's quite interesting to see the detail that's coming through and what they're looking at. And this is what we were saying before. These were the 12 reports that have been published. So mental capacity is mentioned in every single report, as I said before. So I'd definitely get some mental capacity training done. Action plans and continuous improvement are mentioned in most of them, whether or not they had action plans, whether they're doing quality assurance or not. So for those of you with IComply, by doing all of the audits that are scheduled, by doing the team meetings, and by training the team on what you've done, you are doing this, and you are responding to patients as well, and you're doing a system of continuous improvement. Expert knowledge of HTMO 105. So the inspectors now, this is very interesting to see what's coming out in the reports, but the inspectors now know the frequency of the Legionella testing that needs to be done. They know how often your cross-infection control audits need to be done, so they're looking for those 6 monthly audits and action plans. They know, say, for example, that protein tests need to be done weekly and not monthly. That was highlighted on one report. So I think you probably get an idea of the level of detail that's coming through on these. And options noted in clinical records. I think this was from, they attended one practice where a patient had complained, and they looked at the records, and they actually came back and said that the practice hadn't explained his options well enough in order for him to make informed consent. This is probably not a big deal for most of you. You're probably making very, very good notes, but the reason I mention that is how good are the notes that your associate is making. And if a patient complained and the decision went in their favour, would that patient say that it was that associate, or if it was your practice that the problem was with? So how code helps you with these KLOEs and meeting these key lines of inquiry? We've got a document called G106A, which is a gap analysis, and it's called Your Evidence of Compliance. So with this document, you can actually go and have a look at the KLOEs and the fundamental standards, and you can see how you're meeting them and what you're missing. This is more for manual system members, because we're building the KLOE report into IComply. Health checks and mock inspections. Obviously, I'm the practice consultant manager, and I think some of you have met me for health checks, and we're working on the mock inspections now that we know what the new inspections are going to be like. And on that side, we really do want to hear from you as well. So if you're having a new inspection, or if the CQC have phoned you or they've been, please call us up and let us know, because that information is stuff that I will put into webinars, I'll put into our seminars, I will give it back to the rest of the code members. So where I say guidance based on actual inspections. So a lot of the information I'm giving to you right now is based on inspection reports that I've read, on the CQC documents, and from conversations I've had with people who've been inspected or have known inspectors who've gone and done inspections. The IComply Fundamental Standards Report and the IComply KLOE Report, which we'll have a look at in a minute and see how that's going to help you in preparation for inspection, but also on inspection day. Because what I want, which we'll see, what I want and the rest of us here at Code want, is that when those inspectors come to you, you're going to be able to use IComply as the hub for your inspection to show them how you're meeting these prompts, these specific prompts that they have written down on their sheet when they come in and what they want to look at. And then free webinars. Obviously, I'm talking at you today about the KLOEs, and we're going to be doing one of these a month. Okay, so IComply reports. So inside IComply, we've got a section, which we'll see in a minute, which is called the compliance reports. And inside there, you've got a 2012, which is slightly redundant now, inspection. We've got the key lines of inquiry report, and we've got the 2015 fundamental standards report, which has already been live for quite a few months now, I think. Now the way these work is what we do is we take these massive documents, the 155-page fundamental standards document, maybe 154, and we take the KLOEs, the inspection prompts, and we break these down line by line in the back of IComply. And what we do is, whenever you complete an activity within IComply and you fill out the little audit box at the bottom to say what you did, where it's filed, etc., which I advise that you fill out with as much detail as possible, because that's going to give your inspector a lot of information when they come to look at your compliance report. So what you do is when you click that Mark as Complete button, you're actually telling IComply that you have, by doing this activity, you have met these standards or these inspection prompts, and it's constantly building in the back for you an ongoing compliance report, which we'll see in a minute. And ideally, what I want is for it to, the way for it to work is when an inspector comes to your practice, you make them a cup of tea, they sit down in front of IComply, and you show them the compliance report. And they say, well, show me how you're safe. And you'll tick on safe, and it will show them everything that you've done or you've got planned to do. So we'll have a look at that in a second, how that's going to work. So this is IComply, for those of you who don't know it. Every time I'll just jump to the calendar, and obviously you can see here my first month is almost complete. I've been good with my practice and I'm ready for my practice meeting. So I've set my standards, I've done my policies and my procedures, so I'm doing a quality assurance continuous improvement cycle. And I've completed this list in the administration step. Oh, actually, there we go. There we go. So we'll look at the medical history policy, which you can see here. So I've filled out this audit box and I've said, well, I needed to download a template. I needed to update and adapt a template to the practice. So I've not just put a template on file, and any actions have been scheduled or have been completed. And then I've said what I've done. So I've said I've downloaded this policy template. I've adapted it to the practice. I'm going to train the team on it in the next meeting. And I've put an example medical history form on file. Just a little bit extra thing that IComply didn't tell me to do, but I thought it would be a good idea. And the policy is in folder 7 here. Now what that's done is that's actually by completing that and filling that out, when I've clicked Mark as Complete, I've actually date stamped it, and I've created an entry in the compliance report to say what I did, what KLOEs and what fundamental standards I've actually complied with by completing this, and it's generated an entry. And this is what happens every single time we do something in IComply. So if I actually go over here to the compliance report, you'll see I can select my practice. The system takes 1 to 100, as I'm sure you all know, and I can say which standards that I'm looking at. So if I click on 2015 fundamental standards, I get 4 things here. I get regulation, component, subcomponent, and action. And this is to level of depth. So regulation would be 1, 2, 3, etc. Component 1.1, and so on. And I click on the advanced filters toggle here. I can click on whichever fundamental standard I want to look at to see how I'm complying, or to show an inspector. So I can click on, say, need for consent. I'll just do that one. Actually, I'll click need of consent, and I'll put in safe care and treatment as well. Then I'll click apply filter. And what you can see down here is it actually shows what standard I've met, what the review title was I did, the date stamp of when I completed it, what I've done. So what I write in that green box goes there, and where the evidence is stored. So you can show the inspector immediately how you are meeting a particular fundamental standard that they want to look at. Now, when they come and they do a general inspection using KLOEs, this probably won't be important. But if they're doing a reactive inspection, say for example, someone's complained about your cross-infection control or a whistleblower, then they will come in and they're just looking at that standard. So this would be a way to show them what you've done, when you've done it, and to view the activity, etc. So that's how this could be used, and obviously to do a gap analysis as well. What we can also do, if we go back to a compliance report, so if I go down here and I click on KLOE, I can click on the inspection prompts, or the KLOEs themselves. I'd suggest you click on inspection prompts, and I can look on the advanced filters for the different areas: safe, effective, caring, responsive, and well led. So I'm going to click well led for this one, and I'm going to click apply filter, and then you can see down here what I'm doing about well led, what the review titles are. I can click to view the activity to show an inspector when it's due. So if I clicked on that down here, I could show an inspector, well, I haven't done this yet, but I've got it scheduled for the 10th of June. Because quite often if they're not happy with something, they want to know what's your action plan to sort it out. So you've got that right here already. But then I can also show them what I've done. So checking my outstanding to-dos from the previous cycle, the CQC registration, I can show them that I've got my registration details and they're all correct. I can show what I've done about leadership and management, comments and suggestions, etc. So I can see and I can show them based on the prompts that they're using. So where this says well-led 1, well-led 2, well-led 3, these are the prompts that are taken from the dental handbook. So these are the prompts that are the inspector's guide to inspecting your practice and your guide of how they're going to inspect your practice. So what you can do is get the handbook and start looking at it and see, well, how are we meeting these prompts? But obviously we've done that for you, and we've mapped them to the KLOEs and the fundamental standards. So that's there for you. And ideally, you can use this as I said, as a hub for your inspection when the inspector comes in. So you can sit down, make him a cup of tea, sit him down in front of this. He's looking at well led. You can click on well led, see what you've done, see what file it's in. He can pull the file out, have a look at it. It's there. He sees that you've said you're going to train your team on it in the next meeting. You can get out folder 10, look at your minutes, find it on IComply. And we've actually had one practice who, they've not had a new inspection, but they had one of the old style inspections about a month ago, and they used IComply in this way, and the inspector was completely blown away. They thought the compliance report was fantastic. So that's an overview and a quick snapshot of KLOEs, the new inspection regime, and the fundamental standards and KLOE reports.